study, okay? A little case study, clinical case study. So a little piece of paper and a pen. So patient comes to your clinic. He is a 30-year-old male, 30-year-old male with 3-week history of low back pain. So he's got back pain for 3 weeks now. Okay. So 30 years of age male with 3-week history of right side lower back pain. Right side lower back pain. He works in a shopping center and he stacks boxes on the shelves. So he does repeated bending and lifting boxes, okay? And that particular evening, 3 weeks ago, he did extra couple of hours because they were very busy and short of staff. So he had to work a bit extra. So extra 2 hours of repetitive bending, lifting and stacking box on the shelf. And he felt gradual stiffening in his lumbar spine post-work. And when he had to get up next morning, he could hardly get out of bed because of his right side back pain. His pain at the moment, 3 weeks now I suppose, it fluctuates between 3 to 7 out of 10. So he's always in pain or in some mild discomfort, but pain fluctuates from 3 to 7 out of 10. So the aggravating activities are getting out of the bed, really getting this kind of right side, almost like a spasm on the right side of his lumbar spine, and sharp pain. Also, after a period of sitting, getting out and up from a chair into standing. Again, he feels sharp pain, up to 7 out of 10. And also any sort of bending activities that requires big things from the floor, whatever, he's really struggling also due to back pain. It gives him, the pain again around up to 7 out of 10 if he has to do that. Now, 24-hour behavior, 24-hour behavior. So in the morning, the pain is mild, like 3 out of 10, but it's very stiff, and the stiffness lasts for 1 hour until he sort of moves around a bit or has hot showers. So stiffness lasts for around 1 hour. But as the day progresses, his back pain gets worse. So really loading his back, even walking, or like I said, even prolonged sitting, or getting out of a chair after sitting, really becomes quite irritable, that kind of back pain, yeah? At night, it hurts and wakes him up when he's turning in bed, either side. So when he's turning in bed, it also provokes his back pain and wakes him up. He's currently taking some anti-inflammatories as well. Voltaren tablets, 100 milligrams, slow release. He finds it a bit helpful, like in terms of stiffness and that pain. But he's a bit not sure what to do. He's not sure, he hasn't seen a physio yet. So you are the first person to see him. So So his medical history, okay, he doesn't have any cord equina, he doesn't have any leg symptoms. So think about, if I haven't said anything on top of this, that means there is nothing to worry about in terms of any red flags or yellow flags, you know, that kind of thing. So what he wants to know, now maybe we'll leave it here for now, so you've got this history. So what I would like for you guys to do, if you remember that in day one we looked at the lower back pain classification system, remember? Yellow, red flags, then look central sensitization. We also looked at the specific, non-specific lower back pain, you know, and what it is. So I want you to think about, do you think, is this specific or non-specific lower back pain? It's just a hypothesis. This can change again after your objective examination. So I'm just thinking about your hypothesis, what you think might be wrong with the patient. Also I want you to think about what type of pain the patient has. Is it sounds like more nociceptive, mechanical? Is it inflammatory? Is it neuropathic? Is it nociplastic? Think about pain. But if you tell me that this patient's got this particular type of pain, I want to know, why do you think like that? Why do you think this pain or that pain? So thinking about pain type, what I've told you the patient may have. And also I want you to list the plan of your assessment. So what kind of assessment you're going to do for this patient day one. So if he's 3 weeks into this, he's still got this stiffness, pain, it's worsening, you know, by the end of the day. So I want you just kind of to think about what is, or list the plan of your assessment, okay? What I would suggest you to do, try to answer by yourself, maybe for 7 minutes or 10 minutes if you like, and then compare your answer to your colleague, your friend. See if you're thinking along the same lines, okay?